Let's take a look at how we're doing today in Ontario. The province recording its second highest daily case count to date. The province adding 4,227 new infections. The last time the numbers were this high was after Christmas in early January, when 4,249 cases were added. More than 1,200 of today's cases are in Toronto. Neighbouring Peel accounts for 762 infections. More than 61,000 tests were conducted in the last 24 hours. A live look at Ottawa, where the Canadian flag is at half-mast for the death of Prince Philip. The Prime Minister will be speaking soon, coming up at 11:30 Eastern Time. I want to turn now to CTV News infectious disease specialist, Dr. Abdu Sharkawy. Doctor, good morning to you. Good to see you on this very busy news day. Let's start by talking about where we are with the case counts in Ontario, over 4,000.
Yeah, what can I say? I mean, this is certainly a really disturbing and disappointing juncture that we've reached. It's uncharted territory in terms of what this places, in terms of a burden on our ICU capacity, in terms of more surgeries that are going to have to be canceled, in terms of more non-COVID related care that is going to be compromised, in terms of burnout for healthcare professionals who have been stretched to their absolute limit and beyond. And frankly, in terms of all of the communities that continue to be disproportionately impacted by this, this is really disappointing. And it's upsetting when I have to think about the concept of triage being put to the test like never before. We talked about who may or may not be eligible for being put on a ventilator or receiving critical care admission and monitoring if the situation reaches a dire scenario as it has right now. And it's certainly evolving towards that. This is just a tragedy that was preventable. And I think everybody needs to grasp and simplify their lives. And if you have the ability to stay at home or to do anything that limits your contacts with everyone else, you've got to exercise it. If you have an opportunity to get vaccinated, please get vaccinated without delay. If you have questions and you're uncertain or you're fearful, please reach out to somebody to help clarify it for you. We have absolutely no margin for error at this point in the province of Ontario.
So I'm glad you sent out that message reminding everybody to get their vaccine if they're eligible to do so. We've been in this long enough to know that we look at 2-week cycles. Do you expect, Dr. Sharkawy, that by next week, fingers crossed, everybody staying home, that more vaccines out there, that we can expect that those numbers, those daily case count numbers, will start to be on the decline?
Well, I think it's going to be a balance between whether or not there were enough gatherings during the Easter holiday break, potentially before that during Passover, and whether that outstrips the benefit that would have been gained by getting vaccines. And don't forget that vaccines take about 2 weeks before they start to impact in terms of early immunity being constituted, and that's in very young, healthy individuals. It's not necessarily in 65-plus-year-olds or 70-plus-year-olds. So to be honest with you, I'm not terribly optimistic we're going to see much of a decline in the next couple of weeks, and I expect the opposite, actually, here.
Oof, okay. Now, we saw Premier Ford a short time ago getting his shot. He got the AstraZeneca vaccine, and we've been talking about the importance of public figures getting the shot. We know, Dr. Sharkawy, that the AstraZeneca vaccine has had a lot of bad publicity. Can you talk to us about the significance of anybody getting that shot, what they need to know, and, you know, some of the questions that they might have around the safety and efficacy of it? Can you answer them?
Certainly. You know, I've mentioned before, I think the AstraZeneca vaccine is an excellent vaccine. It's a good player. It's had a terrible coach. The messaging has not been very good. It hasn't been transparent. And so it's really been compromised in terms of the brand being recognized as one that can be trusted. But that should not mean that the science and the evidence should be dismissed. We have real world evidence from millions of people having been dosed with AstraZeneca in the UK, where the B117 variant, which is the dominant variant worldwide, is the biggest problem. And it has done very well, particularly in people over the age of 65. So I'm very glad that Minister Elliott got her vaccine through AstraZeneca and that Premier Ford did the same thing. I know that there is certainly some level of apprehension for women that are under the age of 55. And I still think it's prudent to regard that situation with a bit of caution and to see where the data finally ends up rolling out with respect to whether this signal of unusual clots will continue to grow, whether it will settle down and suggest that maybe it's something related to the European population and maybe a bad batch that triggered an immune reaction. Because remember, we haven't seen a single case of any one of these clots here in Canada, with several 100,000 doses of AstraZeneca being given already. So I do hope that the trust can be rebuilt, and I think it will, but it's going to take a monumental effort on the part of public health messaging, people like myself and others, to do that.
Indeed. Okay, Dr. Sharkawy, thank you for all that and for those important reminders. We'll see you again soon.